Hi, Kelly. Thanks for joining us today. I just thought I would start by asking you to share with the audience what your background is in nutrition.
Yeah, so my name is Kelly Carter. I'm the founder of Kelly Carter Nutrition, and I'm a certified nutritional practitioner. So I went to the University of Guelph and got my Bachelor of Applied Sciences in nutrition. And then I went over to the Institute of Holistic Nutrition to get certified as a nutritionist. After that, I joined the board of Canadian Association of Natural Nutritional Practitioners so that I could work on making sure that these services are really recognized, especially in the insurance industry, so that people can get more coverage, which is really important to me.
Well, I think that's awesome. I just want to quickly share my background. I'm a pharmacist of 30 years, and I'm a women's health expert. So I've been working with women for over 25 years with saliva testing and nutritional supplements, herbal supplements. But I thought it'd be great to get your perspective on nutrition because that's not my specialty. So I think today we were going to talk about, some really simple steps that women can take to improve their nutrition and with the followed effect of improving their hormone balance. So I'll let you speak to that, Kelly.
Thank you. So there's so many things that you can do right now today to really help balance your hormones, especially with women. We find that there's so many different factors. And the one thing that I do want to focus on educating you guys on today is what you can start minimizing or maybe even completely removing from your diet, because there's real whole foods are always phenomenal. So I'm just going to mention 3 foods or food categories that really could massively help your hormone levels start balancing. And the first one is red meat. So it's not about eliminating it completely, but red meat typically contains very high amounts of saturated fats and hydrogenated fats. And these consumed in high amounts can really affect hormone levels, especially estrogen. So it's a really good way to start seeing results is lowering that red meat intake and replacing it with other proteins. It could be plant-based like beans, lentils, chickpeas, but it could also be like fish or seafood or even more white meats like chicken. The second would be processed foods. So this one for some of you might be a no-brainer, but we don't really know what goes into processed foods. And a lot of the times it can really, the combination of whatever they're putting in there, the high fat, the high salt, the preservatives, all have a massive effect on our hormone levels as
And
well.
I,
So whenever you have a chance, sorry?
sorry, go ahead. I just want to add something to that. Go ahead.
Yeah. Whenever you have a chance to go the whole real food route, it's way better than going the processed food.
I just want to say, Kelly, that sometimes women don't realize what processed is. So that can be a bit of a learning curve for them. Like they may feel that they're eating healthy, and I know that they're doing the best that they can, but they may just not know what those things are. And I think that's an important learning point for them also.
Absolutely. I usually say real ingredients don't need nutrition labels, and anything that is processed will have one. So that's a really good place to start. And we can definitely dive deeper in that at a later time, or if anyone has any questions. The third is minimizing or removing, if you can, caffeine, because caffeine has a really, really big effect on a lot of people's sleep cycles. And that really affects hormones as well. And a lot of people are going to kind of like seize up and not want to do that. But look at how much caffeine you're drinking in a day. A lot of my clients don't realize that they're getting over 20 ounces a day without even thinking. Like anywhere between 30 and 40 ounces is very normal for people. And depending on the quality as well, quality plus high amount is very, very, very harsh on our systems.
Well, I think women don't always recognize that caffeine can also trigger hot flashes for them. And,
Mhm.
and the other point is that it's dehydrating them. So if we're encouraging them to increase their water, we need to encourage them to also lower the caffeine to offset the benefit of what that goal is. So, right?
Exactly.
So, Kelly, if you had one simple thing that women could start today, what would that be for you?
You kind of took the words out of my mouth, it would really be focusing on water intake. Water intake does so many things for the body, but what it does is in terms of food, you're not going to feel the cravings as much or be as hungry if you're properly hydrated. And it can replace a lot of the caffeine that you're drinking in a day, because a lot of people drink coffee for the energy that it brings.
Right.
Water can bring very, very beautiful energy to the body as well. So really focusing on the one thing that I would say is focus on increasing your water, and so many other things will trickle down after that.
I think that's such a great starting point. And how much water would you encourage them to be drinking every day?
So it really depends on, how tall you are, how much you weigh, how much activity you have, and everything like that. If you really focus on getting 2 liters, the standard 2 liters of
Yeah.
water a day, how hard was that for you? How easy was it for you? My other tip on water is do not chug it, because if you have too much water in a small amount of time, it can actually really hurt your system as well. So sipping, sipping, sipping. Be careful of not going 2, 3, 4, 6 hours without drinking any water.
Well, I think that's absolutely great advice. I just want to thank you for joining me today, Kelly. I know you're on the same pathway as I am, and that is to support women's health. And I think the information you provided today is just awesome. It's a great starting point, one step at a time.
Thank you so much.
Okay, thank you. We'll see you another time.